I had so many questions around coronavirus, and I had somebody from Services Hospital as well. But it's just there's so many people with opinions these days on coronavirus. Everyone thinks they're an expert. So I was like, maybe I talk to an actual expert and see and match your knowledge with WhatsApp messages. So I was like, thoda sa zara different. Zara cheez pe I want to talk to an expert about what is going on. Like yeah. Please take it. And before we start, just a little
Yeah.
about yourself. From what I know, you did your public you studied public health in Harvard and you studied medicine in Aga Khan, if I'm not wrong. And you are in Boston
Yes.
right now, or Lahore?
So I'm in Lahore right now. But just to sort of step back a little bit, I completed my medical school from Aga Khan and then moved to Boston, where I trained at one of the Harvard training hospitals. And then because of my long-standing interest in public health, I completed my master's in public health from the Harvard School of Public Health. And I've been in Boston since then. But I sort of chose the best or the worst time to visit my family this year, which was right before the
Oh no,
corona
so you're locked
pandemic.
basically.
I am a little bit, but I sort of knew what I was heading into. I knew that I could expect to be here for a few weeks.
Okay.
Luckily, this was the time of the year that worked out for me, and also, I just thought that it made sense for me to be close to family. I mean, if there is any time to be close to family, that's when it's stressful, and
Yeah, yeah,
my
yeah.
family wants me around as well. So. It was a very much of a conscious decision, but you can say that I didn't really think it through. I didn't expect things to get
Yeah.
so drawn out. But it's all good for now.
But no, no, glad that you're on here and here with us talking, and everyone is safe at your home. But in Pakistan, at least, Pakistan mein to abhi there's Ramzan Mubarak and there's also Corona Mubarak, because like congressional prayers and everything is allowed. Like, why, why aren't they taking it
Yeah, I
seriously?
mean,
Or are we exaggerating? Are we the fools? I don't know.
I think I think that's a good question. I mean, I think I understand that there's an academic and a philosophical and the right answer to your question, and then there's a realistic answer to your question, right? And I think the academic in me wants to be very pedantic about it and say things like we should absolutely close everything down, and I do think that that would be the ideal approach where we take social distancing seriously, where the government comes down with an iron fist almost
Mhm.
and imposes a total curfew. I mean, there are countries where there are shoot at sight orders in place
Yeah,
if
yeah.
anybody comes out without valid reason. I mean,
What's
places
the
in the
name? They shot two people there.
I think
Philippines, I think.
Philippines.
Dorte,
Yes,
yeah, yeah, yeah.
Philippines. Yeah.
Yeah, he को
So
वैसे
I
भी
mean,
भाग रहा है, but yeah.
so there's that, and then obviously in our neighboring country in India as well. I mean, they have really come down hard on congressional prayers. I mean, it's easier for them, and it aligns to their Hindutva policies, so to speak. But I mean, that was the right thing to do because the biggest outbreaks recently in India, at least in New Delhi, have been at Tablighi Jamaat related events, which also has been the biggest outbreak in Pakistan, which was the Tablighi Jamaat event in Raivan. So I think that would be the right thing to do for sure. The government should really come down with an iron fist. We should impose certain measures which mean that people are not allowed to congregate in large numbers. But then, unfortunately, we're also talking about, we're comparing Pakistan, which is a weak democracy, to countries like Tunisia and Saudi Arabia and the UAE, which are all monarchies, and where the state funds all the mosques and all of these religious institutions. So it's easy for the state to say, we're going to fund you for the next few months, just close things down. And then you also have folks like MBB and other more authoritative leaders who can really bring their fist down on their people and impose the rule of law. Unfortunately, in Pakistan, we don't have that. We have a very weak democracy. The mosques are not funded by the government; they're funded by their own private donations, and so which is why they have an added incentive to not lock things down and to stay open because they depend on chanda and they depend on alms and zakat and sadaqah. So that is their perspective why they don't want to close down. But absolutely, I agree with you, and I think that should be the messaging across that we this is the time to sort of take refuge in our houses, not congregate.
Yeah.
Um, and frankly, that is what needs to happen. But unfortunately, I mean, I live in Lahore, and Congregational prayers are going on. There are certain instances, I think, in certain parts of the city where people are relatively more, I think, that people have better means. The mosques are larger, and in cantonment-related areas, at controlled areas at least, there is some semblance of order. There is some social distancing happening in the mosques, but this is not the situation in the vast majority of the country, where in mosques, people are congregating, they're not maintaining social distances, and that is unfortunately a recipe for disaster.
And and to be honest, I also feel that it's not just Pakistan. Like it's all over the world right now. No, like people are getting out. Even the US.
Yeah.
Where was it? I forgot the name of the state, but they had basically anti-vaccine protesters were
Yeah.
basically out there, not even letting doctors go to the hospital. They were like,
Right.
no way. So crazy goes everywhere, I think. Um,
Yeah, yeah. I mean, I do. I mean, again, this is not to say that. Yeah, this is not to say we are as good or we are as bad as anybody else or somebody
yeah,
else is as bad as us, but I do think that confining human beings to a space, and sort of and then especially when there are economic and financial considerations at place, at play. That's a problem, and you're right. I mean, even in some of the most advanced countries in the world, especially U.S. and Oklahoma and D.C., in Washington, the state, there have been protests where people have come out against the government orders to lock cities down. I mean, just recently in Georgia, the governor of Georgia, which is one of the largest states in the country in the U.S., has basically started easing lockdown and has started ordering allowing businesses to open. In fact, on Friday, the first wave of the ease in lockdown went into effect, which allowed businesses such as tattoo parlors, gyms, and hairdressers to actually open, with certain with certain restrictions in place. So yes, I mean, countries are opening up. There are countries like Sweden which actually never imposed a lockdown, as interesting as it may sound. They
oh, really?
wanted, yeah, so Sweden never really imposed a public lockdown, and they basically took the approach that we have a educated society, we have an educated public, and we want them to sort of decide for themselves how they want to do it. They issued guidelines, and they issued directorates on what they want people to do, and then but they never really imposed any strict lockdowns.
But any idea
um,
if that helped, or like in comparison, were the cases exploded or didn't, or was the society mature enough?
Yeah, I mean, unfortunately, it's really hard to trust any number right now, just because no country in the world really has come to 100% testing. So the numbers are biased. It's almost like comparing apples to oranges. It's hard to compare numbers in Pakistan with numbers in the U.S. The U.S. is doing almost 1.5 million tests a day. Pakistan's capacity to tests at present, I believe, stands at a few thousands a day. And so this is to say that we really don't know the actual scale of the problem in Pakistan, which is why when we talk about COVID positive people, the actual number is probably much larger. And when we talk about COVID-related deaths, it's possible that a lot of people are dying of COVID-related complications, but are not being recognized as such, especially in the smaller towns, where access to healthcare is not that much. I mean, I can tell you from personal experience that, or not, sorry, personal experience, but somebody I know who lives in a smaller city, had heard of a case where somebody had very pathognomic or telltale symptoms of COVID. But they were all, the hospital that they went to, everybody basically decided not to label it as a COVID case, because they were afraid that should the patient sort of expire or not survive, the whole government machinery would get involved. The body would need, the funeral,
Mhm.
etc., would be sort of taken over. So there are those instances as
There
well
are
where
those
people
pressures.
are trying to not really.
That's a very good point. Because in Pakistan, I know a lot of people won't get tested because they say, "यार अगर हमने test किया, police आ जाएगी, and they'll take us
Yeah.
to quarantine zone." And that's a real concern.
I that that is a real concern. I mean, I know a friend of mine, her uncle got tested and then tested positive, and then as you said, as you mentioned, the government came in and then wanted him to go to a local isolation facility. So that certainly happens. But I also, and to your point, I know of people who. I know of a physician actually who is not actively practicing right now, but she had again telltale signs of COVID I think she and I both sort of knew when we spoke over the phone that she could very possibly be COVID positive, and she didn't want to get tested for the same reason. I mean, she lives in a she's obviously from a relatively affluent background, and she didn't want to, because I mean, with her it was a different situation. I think she felt that she had the knowledge and the information to know what to do about it, to stay at
Okay.
home, not go out and self quarantine. So she decided to self quarantine at home without really getting tested, and basically wait the symptoms out. Because her symptoms never escalated, she never got sick enough that she really needed any medical help. She was able to do this at home. So I mean, there's that element too. People are afraid of what would happen if they test positive, because then they don't know what's going to happen to them or their families. Because one element is the patient who tests positive gets taken away. The other element is that their family then gets gets tested, and then they also get their life sort of almost turned upside down. So there's that fear and lack of information, and I think, I feel like our government has been comparatively, compared to past governments, and I think other regional governments, I think our government has been pretty transparent. I mean, the special assistant to the Prime Minister on Health has been sort of coming out and, with regular press conferences, has been updating the public. But I think there's still a gap in communication. I think for most importantly, the government needs to sort of placate the public's fears about what would happen if they get tested. There's a lot of fear of the unknown, of what would happen if we get tested. And I think this is almost not as bad. This is actually worse than the fear of what happens if you do get the virus, because people in our land of the pure are very nonchalant about life and death, for that matter. And I think I've met young, old, all sorts of people who've told me that life, they believe in fate, and if they are going to get it, they're going to get it. So they're going to do what's necessary, at least what's minimally necessary, but they're not going to go above and beyond to sort of get locked down. But so the government really, I feel, needs to step forward and provide
Because
information on.
No, you're right. You'll be surprised how many people for the longest time also believed कि यार Pakistan में तो if people have had donkey meat at some point in their life, so this is nothing. And a lot of people actually believe that. A lot of people, like, I've had these discussions with, I won't say मतलब super intellect, but पढ़े लिखे लोग. I'll be like, yeah, they will like, yeah, our immunity is already so strong, bro. It's just we're
Yeah.
gonna be fine. And that is
Yeah.
such an unfounded belief. And the thing is, इस तरह के belief के साथ you can't really, like, it's like they will say, यार आप तो doctor नहीं हो. If I say something to them, they're like, how do you know? And the fact is true. How do I know?
Religion is dogma, right? I mean, it's not something that we have. I mean, I'm a believer. I mean, I'm also ritualistic. I pray and all of that, but I also understand that religion is about belief, and there's not a lot of proof for some of it. And
Yeah.
so you can really argue with dogma. You can't really argue with somebody who's going to tell you that, zindagi to Allah Ta'ala ke haath mein hai, I don't, and I'm going to leave it to him. So you can't really argue with that. But I think Allah Ta'ala se dua ke saath, parhez ke saath, I mean, we also should be taking precautions, because, belief in God doesn't really, I would say, absolve us of the need to take precautionary measures to sort of be healthy and be safe. So yeah, I mean, I agree with that. I think we certainly have a relatively more casual attitude towards life and death than somebody else. I mean, we feel like it's not something that's totally in our control, and there's a higher power at play. So we feel like we can leave it up to him, and we don't have to do as much ourselves to sort of make sure that we survive this, which I believe is not the right strategy, and that people should be taking this seriously. And when we started talking, I realized something. I realized that there's a little bit of an irony in the fact that the people who I think the vast majority of people who listen to our conversation are people who already are, I think, are relatively, I would say, more,
More
concerned
aware,
and are
maybe.
aware, right? So they are already doing it. It's almost as if we're preaching to the choir. And it's actually people who are not going to be able to
That's
listen
true.
to this podcast,
That is
and
very
people
true.
who necessarily don't have the education and the awareness that we're lucky to have, who really need this message communicated more. So, but I mean, but I think even then, I think through propagation, maybe people who listen to this might be able to communicate it to other people.
Yeah, that's the hope, right? But you're very right. Like, I was having this discussion with someone and I was like, in the end, hum jo marzi keh dein, we only represent maybe the 10%, you know.
Mhm.
But the 90% people in Pakistan are people who earn a wage of at max 25,000 a month. At its lowest end, that's also 5,000 rupees. And these are married
Right.
people with children,
Right.
and that is one page जिससे उन्हें कमाना है. जब आप उनकी जरिया माश आप काट दोगे, while I've been very critical of government's action in this pandemic, but at the same time I'm like, with these people, अगर आप 90% लोगों के पास they don't have money, what are they gonna do? They're not gonna care about corona. And I'm like, if I think about it, if I'm in that situation, I'm a young person, even I'm asynchronous और मुझे नहीं feel हो रहे symptoms, and I'm like, I have to take care of 4 kids और मैं उनके खाना सब कुछ करना है. I'd be like, man, this is a bigger virus for me than corona. And I feel that's just a reality. That's just a sad reality. I don't even have a solution for that.
I mean, it is a reality. It's not a reality for us, but like you said, it's a reality for millions of people. I mean, जब हमारे घर में जो लोग काम करते हैं या जो हमारी जो my brother works in construction, so the construction industry has opened and he has gone back to work where he's interacting with hundreds and thousands of daily wage laborers, and I was talking to him about it. I was like, I was asking him about what his experience has been, and how what is the level of urgency with among the people that he works interacts with, which are just the regular Pakistanis. And he was telling me कि वो लोग मुझे ये कहते हैं कि जी कोरोना तो हमने देखा नहीं है, लेकिन जो हमारे बच्चों का खाली पेट और खाली हमारे घर में जो खाली हमारा जो पैंट्री जो खाली वो हमें नज़र आता है. सो जब when we try to sort of decide कि हम भूख से मरें कि हम कोरोना से मरें, फिर हम कहते हैं कि जी भूख तो हमने देखी हुई है, हमने एक्सपीरियंस भी की, एंड वी नो इट हर्ट्स एंड वी नो व्हाट हैपेंस. कोरोना तो एक इट्स स्टिल एन इमेजिनरी
Yeah.
फिगमेंट ऑफ समबडीज इमेजिनेशन, सो इट्स हार्ड टू रियली से कि ठीक है हम भूखे मर जाते हैं या हम भूख टॉलरेट कर लेते हैं लेकिन हम कोरोना के से बच के रहेंगे. सो इट्स वेरी मतलब हमें I mean, मैं बाहर रहता हूँ. I come back every year, and even then I had sort of almost lost my sensitivity to, even though I try not to, but I feel like in some ways we have lost sensitivity to, people and the realities, the daily realities of people around us. अभी कुछ दिनों पहले हमारे घर एक खातून, somebody referred to us for work, and elderly lady, and it turned out after एक दिन अभी रमज़ान शुरू नहीं हुआ था, and एक दिन मेरी अम्मी ने उनसे पूछा कि खाने का पूछा, तो she said कि जी मेरा रोज़ा है. अच्छा, फिर मेरी अम्मी ने उनको इफ्तारी दे दी. अगले दिन दोबारा मेरी अम्मी ने पूछा, कहती जी मेरा रोज़ा है, तो मेरी अम्मी ने दोबारा इफ्तारी दे दी. फिर एक दिन तीसरे दिन मेरी अम्मी ने उनसे पूछा कि अम्मा जी अभी तो अब रमज़ान शुरू नहीं हुआ है, आप वैसे ही रोज़े रख रही हैं. Then it turned out that they didn't have food at home, which is why the adults in the house had started fasting, because they didn't have food, and the choice was कि हम खाएं कि हम बच्चों को खिलाएं. So this is the reality. This is the reality of like thousands and millions of people in this country. और हम it is easy for me and you and people from our backgrounds
Yeah.
and our like privilege to say कि जी दुकानें बंद कर दें, सब कुछ बंद कर दें, businesses बंद कर दें, but people are dying of hunger, and unfortunately the state is not able and does not have the capacity to provide
Yeah.
for them. I mean, our prime minister is very clear about it. He's been very clear about the reality that we do not have the resources to feed this country. I mean, frankly, the biggest countries and the most resourceful countries in the world do not have the ability or the capacity to sort of feed their countries also, at least I would say for too much time. I mean, I live in the US. I know the government has sort of started giving $1,200 to every citizen who makes between $75,000 to $99,000 a year. But this
Yeah.
is a one-time stimulus thing.
One
I
time
mean,
stimulus. Either be they're
right.
giving, I think, $2,000 for up to jab tak, I think 3-4 months, or if the pandemic continues. But you're right. The reality is that even people here in retail and stuff have lost jobs. जो US का problem है, वो जो आपका red states हैं, वो यही मसला है ना. They're becoming jobless again, because most of these people were jobs which were
Yeah.
like outdoor, retail, minimum wage. They got crushed by corona.
Yeah, yeah. And I mean, I work in healthcare, so I'm lucky in there are certain sectors which are relatively immune to, in fact, are even needed more, during these health crises, and healthcare is one of them. So obviously we're lucky in that way, but I mean, so many more people are not. I mean, no matter where you go in the world, people are really suffering financially. So it's a very hard compromise to make. It's a hard negotiation to do between basically not being able to earn, and between being between these sort of social distancing and other the needs of the need to do all of this. And I mean, even in again, I'm not trying to make an argument in favor of not doing any of this, but I'm just saying that even in the US, where I live, I mean, the COVID pandemic has really, again, I would say, unearthed the inequality in the society. I mean, even in the US, African Americans are dying at a much greater proportional rate than
Oh yeah.
other communities, because people most most vulnerable to health crises, people with the least, I would say, or the most crowded living conditions, and basically all the risk factors that make you vulnerable to disease. I mean, they're in higher prevalence amongst African American communities. So whether you go to the US or whether you come to Pakistan, I mean, it is pandemics like these that sort of reveal the ugliness in our society, the inequity in our society. How even in Pakistan, I mean, there are people who live in their fortresses and who are able to wall themselves up in their fortresses without really having to worry
Yeah.
about what's happening outside or
Everyone does
who's
not
dying
have that
outside on the
luxury.
street, right? I mean, there's
Most
certain, I
people
would
don't have
say,
that luxury in Pakistan.
most people don't. But वही बात है ना कि जब हम अपने घर में अपने आप को बंद कर लेते हैं तो it's very easy for us to forget what's lying outside. I've had to go out a little bit, for a few things and a few errands. So I mean, लाहौर में मैंने अभी इतना बुरा हाल नहीं है, but I think इससे पहले मैंने कभी इतने लोग नहीं देखे थे जो सड़क के ऊपर खड़े होते हैं, like at least अगर if you go out of defense and into Gulberg and all of these areas, जो कि सड़क पे खड़े होते हैं with a mask on their face, who basically just waiting for somebody to give them money and ration. So things are getting bad, and I will say that because I think Pakistan was relatively late in putting in the measures that were needed. We have not yet reached our peak, and I think we are still at least a few weeks, or at least a few weeks away from reaching our peak, and we will reach our peak. So we still have it remains to be seen how bad the situation will get. This is not the peak in Pakistan for sure.
Yeah, so I have a question about that as well. I keep on hearing the word, it's gonna peak
Yeah.
and then it's gonna come down. Is it for sure that once it peaks, it's gonna come down? Is that how it works? Is
Yeah.
that when we start flattening the curve, it cannot flatten before it? What? So yeah, this.
Yeah. Yeah. So when we talk about transmissible diseases, or communicable diseases, like any infectious disease like the COVID, think of Pakistan as one room, and think of all the Pakistanis in the room as, let's for ease, let's say there are 100 people in the room, in this country called Pakistan. Now, if one person gets infected, he's going to there's a number called the R square value, which basically refers to the transmissibility of any disease, and it's different for different pathogens. So
Okay.
for COVID, it's different from that. It's different for the influenza virus. It's different for the Ebola virus, and it's different for the COVID virus. So let's say the COVID virus, if one person has it, he transmits it to two people, and each of that person then transmits it to another two people. So you can see how what started from one person quickly exponentially spreads in the room. But at some point, once almost everybody has been infected, let's say once most people have been infected, the people who remain in the room or are in the room, there will not be any more uninfected people in the room, right?
Okay.
So at some point, infected people will not be infecting only new people. They will be coming in contact with people who are uninfected, but also people who have previously been infected and who are immune. So
Yeah.
what started off as one person infecting every two people will at some point go down to one person infecting just one person, because the second person that he's infecting has already been infected,
Infected.
right?
Got
So
it.
basically what started off as everybody infecting two uninfected people will transition to one person or one infected person infecting only one infected person. And
Okay.
then eventually it will come to the point where everybody's been infected, right? And
Isn't that
everybody
two
has some
different things,
level of,
or is it the same thing?
sorry? Oh
Isn't
no,
that,
so the
isn't
flatten
that
flatten the peak is different.
okay?
So this basically means, what I explained previously basically was an explanation for how pandemics sort of die out. which
Okay.
basically means that once everybody has been infected or enough people have been infected, the virus pathogen will not have any non-infected
Host.
hosts. Exactly. So at that point, the virus has no more ammo. It's not going to cause any more destruction. The flatten the peak basically means that so flatten the peak is a different concept, but it's related to this concept, because what flatten the curve means that we do know that eventually everybody will get infected. Just because that's the reality of things. I mean, unless we cage everybody up or we
Yeah.
lock everybody in a room, everybody is eventually going to get infected, or most people will get infected, right? But the rate at which that happens is under our control, because if we basically let everybody out at the same time, then the transmission is going to be faster. But if we basically, if we keep everybody in a room and only let people out, in increments or in groups, then we can control the rate at which the infection is spreading. So it's almost to say that we cannot, I would say, control how many people get infected, but we can control at the rate at which they get infected. And if we can bring that rate down, we can at least ensure that our existing healthcare capacity is enough to take care of COVID patients at any given time. So if there are 1,000 ICU beds in Pakistan, and we need to make sure that the rate of infection is such that we don't need any more than 1,000 beds for COVID patients in Pakistan. So the flatten the curve basically means that you institute, certain precautionary measures, including social distancing, including personal hygiene, and all of those measures, to make sure that the number of people who are getting infected at any given time are not exceeding the current or existing capacity of the healthcare system. So in that case, I know Pakistan is a bad example because we don't have the capacity to do anything completely at any given time. But take the example of the flu pandemic, right? In the US. So the US has a flu pandemic every year. So every year, a few 100,000 people get infected with the flu, and then a certain proportion of them who are elderly or have underlying medical conditions require hospitalization. But because the number of people requiring hospitalization for flu has almost been kept at a plateau because of regular vaccinations and because of all of the other precautionary measures, the healthcare system is never overwhelmed by those people getting hospitalized for the flu pandemic or the flu the flu thing. So for that, so we would like to sort of replicate that same situation with COVID, where we get to the point where people will still get infected, but they're getting infected at a rate that can be managed by our healthcare
No, got
capacity.
it. Do you think Pakistan has public health wise, do we have people who are actually studying this, or like whatever you told me, do we have people who are thinking this way?
Well, I mean, I do think that our assistant to the Prime Minister, I believe Dr. Zulfikar, he is a public health expert. If I remember correctly, he used to be a regional WHO director, and he also has
Okay.
a master's in public health from the London School of Tropical Hygiene. So I know that that he has the competency to be sort of involved in this.
Right.
But obviously, Pakistan does not have the same focus on public health because there are so many other pressing medical conditions and medical problems that take or supersede,
Yeah.
public health. So unfortunately, we don't have that. I do know that recently I heard that the government of Pakistan released this portal called the Yarane Pakistan, which you should, and I think anybody who's listening to this should look up. So they recently started this portal called Yarane Pakistan, which is meant to tap into our expatriate community. So people living outside Pakistan, including medical professionals, public health professionals, can register on that portal, and then the government will then connect them with local organizations who need help. So physicians basically based abroad, can provide telemedicine services. Public health experts based outside can, sort of add to the capacity of our public health experts in the country. So for that reason, there's that coming up. But to answer your
Yeah, so
question again, we
there
don't
are
have
some
that.
hospitals, like I know services hospitals also started telemedicine or something like that. There are other hospitals who are trying. I know there's some startups who are going to start as well on online medication. But yeah, public health wise as a sector of, having credible people who have the knowledge to make to tell, how to put this control, how to, keep the plateau in check. Because I think that's where it's at, right? London, वगैरह में भी क्या हुआ? People have been overwhelmed. There are not enough doctors anymore. So people just have to die, unfortunately. So yeah, I think that's, but I feel this might just be an awakening call for Pakistan, even for so many countries who just don't care about public health. Like, they say Canada may, well, public health is a very important part of, our
Right.
society, of the country. You have free access to it. But a lot of countries don't see it that way. A lot of countries still don't see public health as, important. But I think this, if anything, is a big wake-up call.
Right. I mean, I hope so. I mean, it's unfortunate, but usually situations like these, which create urgency in any given society. So I hope that the government of Pakistan and our society in general sort of takes this impetus to sort of develop the public health capacity in the country. And you're right. I think the other part is like COVID is not a sprint. It's a marathon. It's going to be around for a few for a few years. I mean, this is not to say that we're not going to
Really?
have another. I mean, I mean, even in the U.S., we're preparing for this to be around for at least 2 years. I mean, so now that everybody's sort of reworking their protocols or reworking their schedules, they're thinking of this sticking around for the next 2 years. So COVID is very much going to be a reality for the next 2 years. Um, and this is not to say that we're not going to have a mutation in the virus that could cause another epidemic. This is something that's going to be around for a little bit, and
Yeah, because that's
so
what they said. I read that on CNN or something that they in the winters there might be another mutation because it'll be flu season as well, and mixing with
right,
corona, it just might blow up
right.
again.
Yeah, I mean, countries like the U.S., where or a lot of the countries that are up in the in the closer up to the north, where the flu is a big thing. I mean, they are bracing themselves. I mean, in fact, the thought is that this is not even as bad as it's going to get in the winter when you have both the flu epidemic and the ongoing COVID epidemic superimposed on each other. So definitely, but I just wanted to make my previous point, which was that
Yeah.
it is situations like these that basically test us. And I think that businesses that don't transform and don't sort of transform to the needs of the post-COVID world are going to sort of are basically going to die out. And any industry that does not understand that they need to change how they do things and meet the needs and precautions and the modus operandi of the post-COVID world, will basically not be here. So
Oh, yeah, yeah.
we
No, no,
so I mean this
completely
whole
agreed.
no,
Please go on.
so I was going to say कि पाकिस्तान में हम जाते हैं अस्पताल में जाते हैं देखते हैं कि जी एक मरीज के साथ 6 लोग आए होते हैं. I mean, there is so much unnecessary traffic in our hospitals. There's so much unnecessary
On our
traffic on our roads. There's
airports.
so much everywhere.
Yeah.
So I think this is the time to start understanding that we need to change that, and that that is where the change needs to come. And then telemedicine and other digital health interventions that are going to be helpful in meeting the needs of the post-COVID world, where we just can't assume that how things were done before can be allowed to carry on.
Yeah, I think there's going to be, there was a world before Corona and there's going to be a world after Corona. Like they're having discussions. Like I just hosted, I was helping up with a virtual conference, जिसको physical conference होती थी Austin में. It was a virtual conference this time about remote work. And you had people
Right.
from Fiverr and other startups. But it happened. The thing is, I think, I personally think the traditional office is going to take a big hit. Traditional office is
Yep.
going to go down. Like people in the US had been spending 12, so it was estimated $12,000 per person लगता है एक average office के लिए if you're in the US.
Right.
And that's a lot of cost, right? And if I
Right.
think also companies are going to realize, yeah, why are we on lease when things can happen remotely? And it's a thinking. And I think this is an easier battle. I feel most of these companies are going to equip themselves through Zoom, WordPress. They're going to do some cost cutting, etc., etc. I think where it's really needed is in a country like Pakistan to rethink economics, to rethink even mosques. Like I was having a discussion with someone, why can't mosques become community centers? Like, why can't mosque have a gym, have a place where people can just come and talk, about, like, अगर इस crisis के अंदर if mosques और community center कहते हैं अच्छा यार यहाँ हमने थोड़ा सा वो भी बनाया हुआ है, people can isolate themselves as well. This is not just
Right.
a mosque, but there are other things
Right.
happening where, we are getting people checked as well, etc., etc. I feel ये सोच है जो हमने, and this will make us rethink everything, because I think if we don't, we're gonna go down. Simple as that, economically and socially and morally, I think.
Yeah, no, I mean, yes, I completely agree. I think we need to transform, and I think Pakistan, I mean, because I mean, we care about Pakistan, and not to say that that's the only place where this needs to happen.
Yeah, yeah,
But I think
obviously.
Pakistan has been living in the woods or in the in the Stone Age for some time now, especially religion. I think हमने मज़हब को मतलब हैरानी की बात मुझे ये है कि जी मक्का मदीना के अंदर अगर तरावी और कॉन्ग्रेगेशन बंद हो गई है जो कि बैस्टियंस ऑफ इस्लाम है, तो पाकिस्तान के अंदर मे बी हमारा हम समझते हैं कि हमारा मज़हब उनके मज़हब से बालातर है कि हम लोग घर में नमाज़ें नहीं पढ़ सकते। अब एक छोटी सी मजाल है कि आई मीन हम जहाँ तक मेरा ख्याल है कि मज़हब के अंदर हमें हुक्म है कि अपने मज़हब को अपने लिए आसान बनाओ, नॉट टू मेक इट हार्डर देन इट ऑलरेडी
बिल्कुल।
इज़, राइट?
Yeah,
सो
yeah.
उसके अंदर पार्ट ऑफ दैट इज़ कि जब हम वैसे भी तरावी पढ़ते हैं, जब हम कॉन्ग्रेगेशन में तरावी पढ़ते हैं, जो लोग पीछे होते हैं उनको तो सिर्फ आवाज़ ही आ रही होती है। और मेरी लिमिटेड नॉलेज के हिसाब से ये कहीं नहीं लिखा हुआ कि तरावी जो है वो आपने आमिल या जो भी आपको तरावी जो भी आपको पढ़ा रहे हैं पढ़ा उनको देख के और उनको उनकी मौजूदगी में पढ़नी है। तो क्यों हम तरावियाँ घर में ओवर 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 रिकॉर्डेड ओवर बिकॉज जो
Yeah,
पढ़ा रहे हैं
yeah.
आपको, क्यों आप रिकॉर्डिंग पे हम तरावी नहीं पढ़ सकते?
बिल्कुल।
खैर, आई कैन टेल यू व्हाट वी डिसाइडेड टू इन आवर होम एटलीस्ट, बिकॉज मेरे दो भाई हैं, मैं हूँ, हमारा घर में ड्राइवर है, तो 4-5 लोग हैं जो तरावी पढ़ने का जिनको था। तो हमने वी फाउंड आउट अबाउट लोकल एक मौलवी साहब थे अगेन जो कि बिकॉज ऑफ द कोविड एपिडेमिक हु हैड लॉस्ट his livelihood because लोगों ने घर में बुलाना बंद कर दिया है and he didn't have any work anyway. So हमने उनको कहा कि आप हमारे घर आके हमें तरावी पढ़ा दिया करें. So basically what we do is हमने बाहर लॉन में अरेंज कर ली हैं 2 कतारें जिसके अंदर जिसमें 4 या 5 स्पॉट्स हैं जो कि which are 6 feet apart from each other and 6
Okay.
feet in all 4 directions.
Yeah,
And वो कारी साहब रोज आते हैं, ठीक है, कारी साहब वहाँ से आते हैं, उनको हमने कहा है कि जी आपने आके अपने मास्क अपना पहनना है जो भी है, और
yeah.
कारी साहब हमें आके तरावी पढ़ा देते. तो I feel के at this is I feel like this was a really good solution to the fact कि हमने तरावी भी पढ़ ली, हम घर से बाहर भी नहीं जा रहे, और जो एक शख्स था जिसको काम की ज़रूरत थी उनको काम भी मिल गया. So I mean we need to improvise and we need to
Yeah.
really think of कि जी हमने अपने मज़हब को और दुनिया को और इस रियलिटी को कैसे चलाना है. और एक तरफ अगर हम ये समझते हैं कि अल्लाह ताला 70 माहों से ज़्यादा मेहरबान और रहमदिल है, तो मुझे नहीं लगता कि अल्लाह ताला ऐसे मौके पे हमें इस बात पे जज करेंगे कि जी हमने तरावी मस्जिद में नहीं पढ़ी, हमने घर में
Exactly.
पढ़ ली.
Just rethink ourselves, rethink religion as well. Make religion more, more practical, how it used to be. I think we talk a lot about Riyasat-e Medina and everything, but implementation zero. We need to actually take examples from, past. And it's not about me. I'm not a super religious person, but I'm generally, reading about religion, whichever religion it is. If you look at the past, all these religions grew because, at least the religions by the book one, were grew because they had some practicality to it. They talked about equality. They talked about how workforce में आपको balance कैसे लेकर आना है. जैसे इस्लाम के अंदर there was the whole thing where they talked about diet, how to control your diet, how to have a better diet. These are very
Right.
practical standards which lot of people, very liberal and progressive people, can be stand behind it. Okay, like, yeah man, this is right. I want to know more about it. So I think that's how we need to rethink. Like, I'll tell you an example here in the mosque. I know either mosque में कभी कभार होता है कि on not on Sunday, on Friday, some people from the church come and
Right.
join the congregation and just come for the sermon and listen to the sermon, etc, etc. Just like that, I think some people from the mosque go on Sunday to the church and
Sure.
do this. I have read Eid ki namaz in a church as well. So it's just यहाँ you don't feel it. यहाँ it's just very very normal. But खुदा ना खास्ता पाकिस्तान में किसी को कहें यार चर्च पे आप ईद की नमाज पढ़ें,
Right. Right.
वो
सही कह रहे हैं.
so
हाँ, मतलब
सोच की बात है.
नहीं, बिल्कुल सही कह रहे हैं आप. आई मीन हमारे मज़हब में सॉरी मज़हब में कह रहा हूँ, हमारे मुल्क में एक वी ऑलमोस्ट नीड रेवोल्यूशन. वी नीड टू सॉर्ट ऑफ टेक अमेरिका के अंदर भी, बाकी मुल्कों में भी एक प्रोग्रेसिव मूवमेंट्स आई थी जिन्होंने, और वहाँ पर भी जो हमारे पीपल दैट वी सॉर्ट ऑफ टेंड टू लिसन टू, जो यूएस के अंदर भी जो कुछ आलिम वगैरह हैं, आई मीन दे हैव अ प्रोग्रेसिव माइंडसेट. they know कि जी आपने मज़हब की you can sort of have, you can follow your religion and be a world player, and I mean
Yeah,
that's
yeah.
the way. And
It's
हमारे मुल्क में भी इस चीज़ की बहुत ज़रूरत है. I agree.
बिल्कुल बिल्कुल. But more than that, I also want to know. I want to know what is herd immunity. I have had very confusing. No, so I actually
Right.
thought herd immunity is basically, oh yeah, so basically get as many people as you can infected. So उसका फिर उन्हीं एक साथ ही then they will cure. जिन्होंने people who will die, or you need to be hospital and immune. But I don't know if
Right.
that's like you would know much more. So
I mean, so herd immunity is the concept कि एक society, एक community के अंदर, the way we, so the herd immunity basically depend कि अब इस तरह समझें कि जैसे मैंने आपको पहले बताया था कि आप समझें कि एक, you know, our society, any given society or a place is like a room and you have like, you know, 100 people in there. अब उसमें ये होगा कि for herd immunity में अगर आप लोग, it depends on exposure to a pathogen, whether that's through infection from somebody else or through a vaccine. Now vaccine we generally are inactivated forms of the पैथोजन जिसमें हम वैक्सीन देते हैं. सो वैक्सीन बेसिकली यही होती है कि अगर पोलियो के कतरों में पोलियो की वायरस होती है इनएक्टिवेटेड फॉर्म में, या पोलियो की वायरस के कंपोनेंट्स होते हैं, उसके मतलब पार्ट्स होते हैं, ताकि जब हमारी बॉडी में जाते हैं तो आवर बॉडी डेवलप्स इम्यूनिटी टू देम, or develops or generates antibodies that then stay on in our body for many years, and
okay.
they develop, इसको जो immunity मान develop होती है उसको आप, you can call them memory cells, ताकि अगर मैंने आज वैक्सीन ली, मैंने बचपन में कतरे लिए थे पोलियो के, लेकिन उनकी मेमोरी सेल्स जो डेवलप हुए थे तब, वो दे आर गोइंग टू परसिस्ट इन माय बॉडी फॉर लाइफ. सो अगर कल को मुझे दोबारा पोलियो से के साथ एक्सपोजर होता है, आई ऑलरेडी हैव द सेल्स इन माय बॉडी दैट आर प्राइम्ड टू रिस्पॉन्ड टू दैट इन्वेडिंग पैथोजन and will basically destroy it. So that's the concept of how we develop immunity to a pathogen. So herd immunity में ये होता है कि if enough people in a community develop immunity, if enough people in a community develop immunity to a particular pathogen, whether that's through exposure to the pathogen, यानी उनको फ्लू हो गया या उन्होंने वैक्सीन लगवा ली फ्लू की, so उससे ये होगा कि जब आपके पास ज़्यादातर लोग ऐसे हैं जो कि इम्यून हैं, तो ट्रांसमिशन रुक जाती है. बिकॉज लाइक आई सेड, ट्रांसमिशन होने के लिए आपको दो चीज़ें चाहिए. यू नीड वन पर्सन हु सिक एंड वन पर्सन हु इज़ नॉट सिक बट हु ऑल्सो डज नॉट हैव इम्यूनिटी, right? Because he does not have immunity, he will get infected, and at that point, you know, will need to develop symptoms, and in the process of developing immunity. So herd
Okay.
immunity का मतलब ये है कि एक community के अंदर अगर इतने लोग immunity develop, एक certain threshold has to be reached of people who are immune to a disease for that transmission to stop. Because per statistically more people are immune than not,
Okay.
and so the transmission doesn't happen, because कहीं ना कहीं वो cycle break हो जाएगी. You know,
As a
you,
public health expert, you think
yeah.
does herd immunity work? Or
I mean, herd immunity is basically our basis for most vaccination campaigns. I mean,
okay.
the reason why we sort of do our vaccination campaigns, you know, जो ये पाकिस्तान में भी जो EPI expanded program of immunization है, जिसमें पोलियो है, hepatitis है, you know, mumps, measles, rubella वगैरह, all of those vaccinations are based on the concept of herd immunity, that if we immunize enough people in the community, you know, enough children, then we are making it sort of statistically impossible for transmission to
Okay.
happen.
But
So
but for herd immunity, then what I'm getting is, don't we then need kind of a vaccine for herd immunity to work, or it can happen without a vaccine? I don't know.
हाँ, तो मैं आपको मैंने आपको पहले बताया था कि वैक्सीन भी आप समझ लें कि द वैक्सीन एंड एक्चुअल इन्फेक्शन इज द सेम थिंग. फ़र्क ये है कि वैक्सीन हम क्योंकि कंट्रोल्ड एनवायरनमेंट में करते हैं, तो वैक्सीन से आप सिक नहीं होते. तो whether you can develop herd immunity through a vaccine, because that's sort of artificial infection, or through a real infection. So अब क्योंकि कोविड की हमारे पास वैक्सीन नहीं है, लेकिन कोविड की herd immunity डेवलप हो सकती है if and when enough people in our community get infected by COVID. Unfortunately, though, we would like कि COVID की, you know, we hope that the COVID solution to COVID does not arrive through herd immunity, because अगर तो हम herd immunity डेवलप करें वैक्सीन के थ्रू, so वो तो एक सेफ तरीका है, because we know कि the vaccine is not going to kill people. But COVID, the infection is going to kill people. So COVID के the actual infection के through herd immunity develop करना इस community में, it's going to come through a lot of collateral damage. A lot of people are going to have to die. But once we have the vaccine for COVID, then we can, you know, use the vaccine to develop herd immunity in our communities. Does that make sense? Or
No, that does make sense because what I'm getting at, if you don't do it in controlled environment, people will actually die.
yes, yes.
Yeah,
So
yeah,
यूके के अंदर जब यूके में कोविड शुरू हुआ था तो शुरू में उनकी जो हेल्थ सर्विस थी they sort of flirted with the idea that let's wait for herd immunity to take effect. So what they basically said was we are not going to, initially thoda der ke liye they flirted with the idea that let's not impose social distancing, let's not lock down, let people go out and live their normal lives. So eventually hopefully hoga ye ke itne logon ko COVID ho jayega, vast majority of whom are going to be asymptomatic or not going to have severe disease, that eventually the transmission would stop on its own. I mean, people are going to die in the, in the process, unfortunately, because of
yeah.
all the people who get infected, some people will die. But they assumed that the deaths won't be as much. But then they quickly realized that COVID is much more transmissible and much more fatal than some of our other pathogens, like flu, for example. So then they decided that we cannot let herd immunity through natural infection be our solution, because that's going to kill a lot of people. In fact, there's some estimates that if COVID is allowed to go on unchecked, we could have as many as 20 million deaths in the world. So, which is why now everybody is really taking it seriously, and, developing herd immunity through infection is not considered a safe way. Which you referenced it earlier when you said, should we just let it go and infect people and sort
Yeah.
of run through our community like a wave? But the masla uska ye hai ki because it can be very serious and can be very fatal. We can't let that happen because there's going to be too many people having the serious form of the disease for us to handle, and a lot of people are going to die.
How generally are we equipped to deal with pandemics? Because what I know, my limited knowledge, is that it's very difficult to really predict the accurate pandemic strain जो आके can affect us. Because I feel ये वाला I think था with was a strain of something with bat and then swine का strain था which mutated and then went into the human body, if I'm
So,
not wrong.
yeah, I mean, there is a little bit of a, the verdict is not out yet, but बताया इसमें हमें, the research so far ये है कि the coronavirus is a bat basically related virus जो कि bat में शुरू हुई, bats में थी, and then it transferred to a human host. And when they've studied the DNA structure of the virus, they found it, or the genetic structure of the virus, they found it to be almost 95% similar to other viruses or other coronaviruses. So the thought अभी तक जो research आई, again, there's a lot more to come, but right now what the science is, what science tells us is this is this is similar, this is from the coronavirus families, and it's 95% similar to other viruses that have previously been seen or are found in certain hosts such as bats, and then it's sort of transmitted over or was transmitted to a human host, and that's how it sort of spread.
How many cases do you predict by the end of year in Pakistan? What do you predict as general, like it can be
Yeah.
less, more, I don't know. What is your prediction by the end of the year? Where will Pakistan stand?
So we're at 13,000 cases right now, and we're still on an exponential increase. I think, and I hope I'm wrong, but I think we're going to reach at least 100,000 plus cases by the end of the year, because abhi hamari, we have not yet reached the high. I mean, the way you can really find out if we are going to get things are going to get better soon is you wait for cases to sort of plateau or at least start falling. We have not reached that state yet. We are still in a exponential rise, and आप इस तरह देखें कि ये disease इस तरह की कि it takes like almost a week or to some days for the symptoms to appear. So लोग जो पिछले हफ्ते infect हुए हैं वो अभी आगे they're going to start revealing themselves. So it's almost as if because हमने अपने जो measures थे वो we took some time to put them in place. People who are getting infected have not yet revealed themselves. So for the next few weeks, we are still going to see cases going up, and then depending on how the unknown load of the case or or cases is in the country, we might reach our peak. I was talking to somebody who works in the public health system here. वो मुझे कह रहे थे कि they're expecting Pakistan to reach their peak around end of May or mid to end of May. So we are still going to see a lot of cases, and like I said, I mean, we don't really know what the caseload is because testing is not exhaustive. So there are a lot
Exhausted.
of people who are not getting tested, who don't
Well, they
have
won't
tests.
be. They
Right.
don't.
So
Yeah.
the public figure is, or the public.
100,000. Got it. My last question. We keep on talking about asynchronous people, young people being a little, safe from coronavirus. How far is that true? Because I feel young people are taking it a little more lightly.
Yeah.
It's just that they think, यार हमें नहीं होगा probably, or maybe it's asynchronous. And even if you're asynchronous, you're like, यार किसी और को शायद मुझे तो नहीं कुछ हो रहा ना. It's like a selfish वो. So how safe are people exactly? Can they even get it again and again? Will that destroy their immunity, or they're just completely safe?
So to answer your first question, I mean, young people are just as susceptible to an infection as anybody else, but
Right.
whether that infection impales them, brings them any symptoms or no symptom at all, that by virtue of being young, obviously they're less susceptible to that anyway. Not just COVID, for any disease, but
Yeah.
there are many cases in the world where young people have contracted the disease and have died from it. So I just want to let everybody know who hears this that young people are at risk and can die. I mean, I know of at least a few health professionals, residents in their 20s and 30s who have died. I know of a Pakistani
There's
resident
no
in New York
underlying disease.
with no
No,
with, with no known underlying disease.
no known
Uh,
disease.
Right.
Right.
I mean, from the there's been at least two cases of infants dying of the disease. But yes, compared to people in their mid 50s, 60s, people with other underlying comorbid conditions, especially people with any disease that immunosuppresses their ability to fight disease, young people are relatively less susceptible to the disease and its severe forms, but by no means should young people be taking this casually or less seriously. And the other reason why don't want young people to take this casually is because even if young people are themselves less susceptible to it, we in Pakistan, at least, we live in families where our grandparents and our parents live with us. So if you don't want to do it for yourself, do it for your family. I mean, this is a little bit off the topic, but somebody a few weeks ago, I had a friend who told me that somebody had played a prank on him, whereby they told him that he's COVID positive, or that the person he had met pranked him and said, I
Yeah.
have COVID, so you should get tested. And his first impulse was, what about my family? Like, I've been living with my parents, I've met my parents since I've met this person. What about them? So even if young people think that they're sort of they're indestructible, their parents and their grandparents are not. So
Exactly.
if you don't do it for yourself, do it for them, and do it for anybody else that you might meet on the street who might be elderly or who might have underlying medical conditions, who you could be unknowingly passing on the disease to, and who could die from your lack of seriousness.
Yeah. Basically, don't be a selfish moron.
Yes,
In other
which
words.
is which is a good dictum to live your life by anyway.
Yeah. Yeah. Definitely. Thank you so much, Dr. Omair. It was a pleasure having you. Yeah, I'm definitely more informed. And yeah, I'll let you enjoy your day. Thank you so much.
Thank you.
And yeah, guys, this was the Yahoodi sausage feed, Dr. Omair Shakeel. Thank you.
Thank you.
See
Thank
you.
you.
Enjoy.